COVID is a new epidemic. It has posed huge challenges to governments all around the world. We have endured 4 waves of the COVID epidemic.
希望做到早發現、早隔離、早治療。
The COVID-19 has got a very big impact on the public health system in Hong Kong because all the COVID confirmed cases are admitted into the public hospital systems. At the same time, we have to maintain our other essential services. So having both stressed on our system, it entails a lot of effort from our colleagues.
By and large, Hong Kong has continued its normal way of life, even though we have maintained a lot of the control measures like masking, social distancing, restaurants, some will have to be only allowed to operate in certain hours, etc. Now, we maintain a host of measures in order to control the COVID epidemic in Hong Kong. The use of innovation and technology is part and parcel of the fight against the COVID epidemic.
ICT and digital health have been tremendously important in the anti-pandemic efforts in Hong Kong. We tried to take a holistic approach to testing, and we wanted to provide citizens with a hassle-free experience. Citizens can make appointments and choose the testing location and their time slot online. We integrate with our laboratory test systems so that as soon as the results are available, citizens will receive their own test result, and also that data will flow through to the rest of the anti-pandemic effort. For instance, for all positive tests, we trigger a whole series of actions, including things like quarantine, notification, preparing the hospital, and so forth, and also giving us a total picture for management.
We try to identify the cases as early as possible, and then of course we want to confirm the diagnosis. Once we identify such cases, we do the relevant tests and examinations to confirm the diagnosis. And subsequently, the other very important step is the early treatment, because we believe the earlier we treat the patients, the better will the outcome. Because of the infection control concern, we don't want to have our colleagues to approach the patient all the time. So we make use of new technology like the Internet of Things, so that when patients they do the self-measurements of, say, blood pressure or pulse or oximetry, we not only make use of our existing isolation bed facilities, we also within a very short time develop a community isolation facilities as well as a community treatment facilities. It's actually quite a number of days when the peak of the different waves, there can be more than 100 of patients admitted at the same time. In which case, our IT colleagues very quickly develop a system, what we call the allocation system of the beds, so that the colleagues both in the head office, our MICC, the Major Incident Command Center, as well as the colleagues in the hospital, they can help to arrange allocation of the bed just by using their mobile phones, which is very useful and give them a lot of flexibilities and facility in terms of where they are going to allocate the patients.
Earlier this year, we have also started the vaccination program, which I think, as the World Health Organization has said, is the most important tool in the fight against the COVID epidemic and one of the most important pathways to return to normality.
We designed a system which would allow us to run a large-scale vaccination effort and provide a complete picture of the vaccination status of Hong Kong. We were able to give patients a choice of which vaccine they wanted and also a time and place of vaccination. And then the system also provides a real-time update on the situation in each vaccination center, how many vaccines have been given, how many vaccines we need in each location. So it's very important to have a complete picture of the vaccination status in Hong Kong. So we've kept all of those records in the standardized format in a centralized database. We also wanted to give citizens access to their own record. So we've made available the details of the vaccination record in their eHealth app, and we also provide it in a form of a QR code. This QR code has embedded in it tamper-proof technology with digital signature, which means that we can electronically verify that this is an authentic vaccination record. So decades of digital health experience have built up a very widespread culture of digital health use amongst our clinician population, and this has allowed very rapid adoption of new tools.
The use of ICT is interwoven with our whole epidemic control framework, including the testing, tracing, quarantine, isolation, and vaccination program. And one of the most important things is the provision of ICT, and the ICT infrastructure has allowed us to achieve what we call the early identification, early isolation, and early treatment of the infected, which is one of the main tenets of the whole COVID epidemic control strategy of the government.